Good afternoon. We'd like to go ahead and get started with our Health Committee meeting here this afternoon. I'd like to announce that we will hear 2 witnesses per side with a time limit of 3 minutes each. And additional witnesses will be asked to please only state their name and their organization for the record and their position on the measure. We would ask that clapping, booing, or other demonstrative actions are not be allowed in our legislative proceedings. The sergeants will remove anyone making a disruption. The consent calendar, items proposed for consent are item number 1, ACR 198 by Mr. Gordon. We have a substitute member today, Assembly Member Kevin McCarty will be filling in for Assembly Member Tony Thurman, who is out of the country. So at this point, seeing no authors, this is and no committee members, this is a really good start. Does anybody have a deck of cards? We would ask authors to come to the item number 2 before us. It would be Senate Bill 586 by Dr. Hernandez, Senator Dr. Hernandez. Barring that, Senator Pan would be next in order. Senator Mitchell. So we will wait until we have some authors. Thank you. Senator Pan, please come forward. So we will be starting as a subcommittee. Senator Pan, you have item number 3, SB 877. Please go ahead when you're ready.
Thank you, Mr. Chair and members, and I appreciate the promptness of this committee. I present to you Senate Bill 877, which will require the California Department of Public Health to reestablish and maintain the California Electronic Violent Death Reporting System. Violence can be prevented when we have data to understand its causes and what we can do to effectively mitigate its risk factors. And SB 877 is a first step toward that prevention. With proper data, we can better understand what drives violent deaths and address the root of the problem. The California Electronic Violent Death Reporting System is based off the National Violent Death Reporting System, which is a state-based surveillance system. NRDVS is only as good as the data the individual states provide, and currently California is not a participant. As a state with the highest population in the nation, California should be a participant in this important national database. SB 877 will give us the information to make smarter decisions that will keep the public safe. There's currently no formal opposition to the bill, and I respectfully ask for an aye vote. Thank you.
Thank you. Witnesses?
Josh Wogolka with the American Federation of State, County, and Municipal Employees. We encourage your support.
Thank you very much. Others in support?
Mr. Chair, members, Amy Brown on behalf of the California Academy of Family Physicians in support. Thank you.
Thank you.
Lydia Bourne representing American Academy of Pediatrics in support.
Thank you.
Kat DeBerg with the Health Officers Association of California in support.
Thank you.
Doug Chiappetta, Union of American Physicians and Dentists, would ask me as co-sponsor in support. Thank you.
Thank you.
Hi there, Dawn Kepke on behalf of the Child Abuse Prevention Center, also in support.
Thank you very much. Anyone else in support? Seeing no one, we'll go see. Is there anyone in opposition? Seeing no one, we'll bring it back to the committee. Questions? Would you like to close, Senator Pan? Well, when we get
That's when I vote.
When we get 8 more members, we'll put it up.
Thank you.
Thank you, sir. Appreciate it. So we'd still like to have some other authors come forward. Senator Mitchell would be next. Hernandez, Dr. Hernandez, followed by Senator Mitchell, Senator Cannella. Senator Cannella, Senator Monning, Senator Laura, Senator Morlock, any Senate authors out there? Senator Leno, who would like to present? I know there are a lot of committees going on today, so I know a lot of senators and assembly members are in various committees presenting. So at this point, any senators who have a bill in Health Committee who would like to present, please come forward and we'll do our best to accommodate you. Thank you. Senator Monning, please step forward. We are so happy to see you. I'm impressed with your efficiency. Absolutely. So you're here to present Senate Bill 1135, item number 10. Please proceed whenever you're ready, sir.
Good afternoon, Mr. Chair and members. Yes, members.
Yes.
Senate Bill 1135 requires health plans and insurers to notify consumers and healthcare providers about a patient's rights to timely access to care and to language assistance. Very few consumers know that they are entitled to timely access to care and in their preferred language. A recent survey found that 85% of California consumers do not know what state agency is tasked with handling complaints about health plans and insurers. The primary goal of this legislation is to help inform consumers of their timely access rights, so if needed, consumers are able to raise the concern with the health plan or regulator. This will also lead to more accurate complaint data collection for policymakers and regulators to take appropriate action. For example, consumer complaints are one of the strongest indicators state agencies have in monitoring network adequacy issues. SB 1135 requires that the timely access timeframes be included in existing enrollee documents and communications that the health plans and health insurers provide. We're also proposing a clarifying amendment that the notice to contracting providers can be part of existing communications. With the Chair's permission, I'd now like to present witnesses in support. Thank you.
Perfect. Thank you.
Hi. Good afternoon, Mr. Chair and members. Tam Ma with Health Access California, the proud sponsors of SB 1135. California law requires health plans to have adequate networks and to provide timely access to care. This means that there are actual time limits on how long a consumer should have to wait to get health care appointments. For example, most consumers don't know that they're entitled to get an appointment with a primary care provider within 10 business days or a specialist within 15 days. Consumers also have a right to language assistance, including interpreter services, at the time of appointment. Unfortunately, most consumers don't know about their rights, so they end up waiting weeks, if not months, for an appointment, and this is unacceptable. All SB 1135 does is require health plans to let consumers know about these existing rights through existing communication channels. With that, we respectfully urge your aye vote.
Mr. Chair, members, Kimberly Chen with the California Pan-Ethnic Health Network, also here in strong support. California's population is one of the most diverse in the country. In fact, residents speak over 100 languages, and more than 40% of Californians speak a language other than English at home. And as my colleague just noted, many consumers are still confused about their right to timely appointments and language assistance services, and this is obviously very much exacerbated for those who are limited English proficient. For many of those consumers navigating the often complex healthcare system, it's not always clear that there's both a right to timely access and language assistance at the time of care. This bill provides consumers with information about their existing rights through existing channels so that they can get the care they need when they need it and in the language that they can understand. And for those reasons, we're in strong support and urge aye vote.
Thank you very much. Others in support?
There's Linda Way with Western Center on Law and Poverty in strong support.
Thank you.
Ann Powell with AARP California in strong support.
Thank you.
Melissa Cortez Roth on behalf of Autism Speaks and the Center for Autism and Related Disorders in support.
Great. Thank you.
Mr. Chair, member Sarah Flox, California Labor Federation in support.
Thank you.
Emily Rush with CalPERG in support.
Thank you.
Mr. Chair, members, Tim Madden representing the California chapter of the American College of Emergency Physicians in strong support.
Thank you.
Kathy Dressler with the Children's Partnership in strong support.
Thank you.
Bless Shepherd representing the ALS Association, Golden West Chapter in support.
Thank you.
Michelle Cabrera with SEIU California in support.
Thank you.
Alejandro Cortez on behalf of MALDEF in support.
Thank you.
Stuart Ferry with the National Multiple Sclerosis Society in support.
Thank you very much. Anyone else in support? Seeing no one, is there anyone who would like to speak in opposition? Please come forward.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I'd first like to thank the author and sponsor. We have had an open dialogue from the very beginning. This is a bill, unfortunately, we are currently opposed to, not certainly about making sure that our members understand their timely access requirements, but more of a function of where it would be best to provide those notices in what form so that the insureds actually understand, read, and thoroughly sort of appreciate what rights that they have. That's kind of the place that we've been struggling with, is in what notification. Currently, under regulation, we require a standalone notice in a newsletter that goes out to insureds to inform them of their timely access standards. I think we're a little concerned about the language assistance programs and what those notifications look like, and to add this piece to it, we think that may not necessarily be the best place, but we certainly are continuing that dialogue. I think we're really hopeful that we might be able to get to a place where we can identify what notices and what provisions this information would be most useful to consumers. But right now, and as the bill is in its current form, we're opposed to it.
Okay, thank you.
Mr. Chair and members, Nick Luizas on behalf of the California Association of Health Plans. Just associate our comments with Stephanie from ACLIC. I mean, the issue isn't providing more information to consumers. It's, are we locating that information in a useful place? For instance, we all receive an evidence of coverage from our health plan. Not a lot of us crack it open, myself included. And I think what our issue is if we start placing more and more information into these primary documents, they become so overloaded with information that they become useless to the consumer. I think we'd like to continue having discussions with the author and sponsor about this bill, but at the moment we're still opposed to the bill. Thanks.
Okay, thank you. Others in opposition? Anyone else? Seeing no one. Questions from members? I have a question actually, and this would be for Ms. Watkins. Do you have suggestions? I mean, you've said that you don't really like where it's going at this point. Do you have suggestions on a more appropriate place for it to go?
We're currently, with our membership, as with many associations, circulating concepts to get sign-off from our members if there are places for which they think it would be more useful. And so that's sort of the iterative process that we've had with the author's office. At this point, I don't have those to present, but I think we're hopeful moving forward that very quickly we will have kind of a more succinct version of what we think would be useful to the consumer.
Thank you. Thanks very much. I see. Are you there to speak in opposition, or do you have a question?
No, sorry. Someone in the back said I could come up and just say autism deserves equal coverage and support.
Thank you. So anyone else in opposition? I guess we've gone through that. Mr. Monty, obviously we don't have a quorum to take a vote, but I'd like to give you an opportunity to close.
Thank you, and I'll be brief, but I do just want to acknowledge our work with the opponents. But this bill has made significant progress, I think, in being narrowed down. We originally thought the best place for the information would be on the card of an insured, their medical card. That posed certain logistical challenges, and so we've agreed to use existing notices that are sent out as the best vehicle, and we've also expanded it to include the notice to providers. And just again, what we're talking about, we're not creating the timely access laws. Those exist. So real important, we're not imposing new timelines. We're just saying consumers and providers should have in front of them a way to know what their rights are for timely access and interpretation services. With that, I would urge an aye vote at the appropriate time when you have a quorum. Thank you.
Thank you, Senator Monning. And when we have a quorum, we'll bring it up for a vote. So, okay. So we're anxiously awaiting the arrival of another author at some point. So. Senator Cannella, we would love to have you present a bill, any bill. Thank you, sir. So we have before us Senate Bill 1098, item number 9.
To oversee Deni-Cal policies and priorities. For more than 13 million Californians of modest incomes, Deni-Cal is the only means to dental care outside of an emergency room. As a member of the JLAC Committee and the Little Hoover Commission, I've heard many accounts that Deni-Cal rules and processes are often harmful to beneficiaries. Most California dentists don't participate in Deni-Cal due to its low reimbursement rates and administrative obstructions. Fewer than half of the people eligible for benefits use them in any given year. I represent counties with high populations of child beneficiaries where there aren't enough dentists. The impact of this program on my constituents leads to expensive emergency room visits, missed school days, and lost job opportunities. I recently participated in a hearing by the Little Hoover Commission on the Deni-Cal program. One of the recommendations that came from the hearing was the creation of an evidence-based advisory group to oversee the program's policies and priorities. This bill implements such an advisory group. I would also like to thank the committee staff in working with us to address their concerns. I would like to accept the proposed amendments. I believe, Terry McHale. I have witnesses here in support, so if that's okay, I'll turn it over to them.
Perfect. Thank you, Senator. Mr. McHale?
Terry McHale with Aaron Reed and Associates, representing the California Dental Hygienists Association. We've been working on hygiene issues for 30 years, and we welcome this committee. Too often this department makes their decisions in a bureaucratic vacuum. The intellectual firepower on dealing with what providers do in dental care delivery system is non-existent in this department, and I hope that they take advantage of this and that we'll see a new era in which decisions can be made that are beneficial to the consumer. Thank you very much.
Thank you. Other witnesses?
Good afternoon, Chairman Wood and members of the committee. My name is Carol D'Elia. I'm Executive Director of the Little Hoover Commission. We support SB 1098 based on our April 2016 report, Fixing Deni-Cal. That review was conducted by the Commission at the request of Assemblymember Wood and Senator Pan. In that review, we found a broken and dysfunctional system with unnecessarily burdensome red tape and unusually high level of hostility between the department and the dental community and the patients and the parents who are understandably frustrated when they could not get an appointment or get dental treatment. In the report, we recommended setting a utilization goal to drive change and create a sense of urgency. SB 1098 sets a goal of 60% or higher utilization. And while our focus in our study was on improving access, a common complaint we heard during our review was the department's unilateral decision-making, where rule changes were often announced without fully seeking an understanding of the consequences. There were two issues that arose during the course of our study that unexpectedly dominated our public comment session at our two hearings. One rule change involved the use of anesthesia. Outsiders told the department that the rule changes were unclear and would be interpreted in a way that would cause confusion. After issuing the new rule, providers were denying treatment to children, particularly special needs children. Another area of disagreement concerned a new rule to require dental hygienists who treat patients in skilled nursing facilities to obtain x-rays prior to doing a scaling or root planing. We heard this would jeopardize the health of this largely immobile population. We didn't make recommendations on either of these issues, but we saw them as a pattern of a department making decisions with a relatively closed process. The volume of calls and public comments strongly signaled a stakeholder community that felt it had no voice. A dental advisory body would provide this voice. It would ensure new rules are not only based on cost considerations, but also based on what's best for oral health. An advisory body would help minimize the continual strife, the confusion, and even the alleged harm to beneficiaries. We support this common sense measure and urge an aye vote.
Thank you.
Good afternoon, Chair and members. Brianna Pittman with the California Dental Association. We're listed as support if amended in the analysis, but are pleased that we are in support with these amendments. We really appreciate working with the author's office and this committee, especially on the amendment to make sure that the committee or the advisory group is looking at whether or not DentaCal is aligned with and supporting the goals of the state oral health plan. It's a 10-year plan that the state's new dental director is currently putting together with a large group of stakeholders, and we think alignment between those will only help the beneficiaries of the DentaCal population. So appreciate this legislation and the aggressive utilization goal that's in there from the report, and pleased to be in support. Thank you.
Great, thank you. Others in support? Seeing none. Anybody in opposition? Seeing none, we'll bring it back to the committee for questions or comments. We're operating as a subcommittee, Senator. At the appropriate time, we'll bring it up, and I'd like to be considered to be a co-author on your bill.
Great, you got it.
All right, good.
All right.
Thank you very much.
Thank you very much.
Appreciate it. Senator Mitchell, would you be ready?